Thank you, Farmer Sonia. The answer to your question is no, for two reasons. One, homosexuality is no longer considered a mental disorder. And two, with paraphilias, the unconventional sexual behavior is with a non-consenting adult, whereas in homosexuality, the person involved is an adult who is consenting to the behavior. Now, homosexuality is no longer, meaning it used to be a mental disorder. So we have two manuals that we use to classify mental disorder diagnosis, and that is the DSM and the ICD. DSM is Diagnostic and Statistical Manual of Mental Disorders, which is authored by the American Psychiatric Association, APA. ICD is International Classification of Diseases, authored by the WHO, World Health Organization. Because we rely heavily on DSM, I'm going to focus on that. So according to literature, DSM 1 and 2 included homosexuality as a mental disorder. But in 1971, there was a gay activist movement that challenged that category as a disorder. And it claimed that because it was put as a disorder, it encouraged the social condemnation of homosexuality. So the society and the cultural norms at the time were condemning homosexuality, and that is what was bringing distress to those who were homosexuals or had homosexual behavior. And so those efforts of gay activist movement are what mainly led to the decision of the APA to reconsider homosexuality as a disorder. The other thing may have been that there was a change in the dynamic of the American Psychiatric Association. They had younger psychiatrists coming into the association, and perhaps their views may have also contributed to the decision to remove homosexuality as a disorder. So you had one group of those who were homosexuals getting their distress and inability to perform their functional roles as a result of social stigma. And then you had those who had their own internal incongruence. So what they felt and what they thought they should feel was not congruent. And that brings about an aspect that we use a lot in mental disorders called ego dystonia. For example, in obsessive compulsive disorder, you find that a person's intrusive thoughts are not in keeping with their own thoughts. And that is causing them a lot of distress. And that's why they would come and seek for help. But for those whose how they feel and how they're supposed to feel align, so they're egosyntonic, meaning there's no problem, it's not bringing them any distress, they're able to continue functioning, then that is not a disorder. So that was the arguing point. There were theories that were put forward that homosexuality was, people were born with it, and that their brain was constituted differently from those who are attracted to the opposite sex. So sexual orientation had some physical differences in people. And so over time, homosexuality was edited, and you realize that in the DSM, illnesses would either have their names changed because perhaps the function that they're performing is not effective. Perhaps there's stigma surrounded with using that term. And so they changed homosexuality to calling it ego-dystonic homosexuality. For those who felt they were not supposed to be attracted to the opposite sex, to the same sex, but they were attracted to the same sex. And so those people were allowed to continue seeking care. But those who felt okay with their homosexuality, then it's no longer considered a mental disorder. So at the moment, there is no diagnosis, a mental illness diagnosis of homosexuality or lesbianism from the two diagnostic manuals that we use to diagnose mental illnesses.